Auditory processing disorder and neuronal linkage. The ear may hear the sound, but the brain struggles to decode the message. Auditory processing disorder is not simply a hearing problem, it's a neuronal communication disorder where the sound signal enter the ear normally but become distorted, delayed, or misinterpreted as they travel through the brain auditory pathway. The main circuits that are involved in the brain is cochlea, auditory nerve, brainstem, thalamus, and auditory cortex. These are the units or circuits that becomes inefficient in auditory processing disorder. Hi, my name is Dr. S and today we are going to discuss auditory processing disorder and neuronal linkage. The normal processing is through ear. Sound enters the ear, then the cranial nerve, auditory nerve, then the brainstem, thalamus, and auditory cortex. These are the main regions through which the voice or sound travel and analyzed by the brain. Disease description. Peripheral hearing may be normal. The central nervous system struggles to use auditory information. Listening difficulty may be their rapid speech or long verbal instructions that cannot be analyzed by the brain, can affect school learning, language, reading, spelling, attention, and social communication. These are the typical patient complaint. I can hear the sound but difficult to understand clearly. Common symptoms frequently ask for repetition, poor speech, confusion, difficulty following multiple steps instruction, listening fatigue. Pathogenesis, that is important. Development vulnerability, recurrent otitis may be the reason for processing disorder. Neurological injury, traumatic brain injury, stroke, epilepsy, and prematurely the hypoxia may also be involved in this. Neuronal development, ADHD, dyslexia, language disorder may be there. The mechanism of disease, that is very important. Sound signals, cochlea, that is the first step. Temporal coding defect, binaural integration defect, auditory discrimination, figure ground defect, and function impairment. These are the steps through which the disease can be analyzed, what is going on in the brain. The example, teacher speaks noisy in class, signals reaches the ear, but brain cannot filter the speech from the background noise. Result, the child hears sound, but words feel blurred. The neuronal linkage, brainstem, thalamus, MGB is the medial geniculate body that relays the information to primary auditory cortex in the temporal lobe. Cochlea, auditory nerve, cochlear nuclei, superior olive, inferior colliculus, MGB that I already told you, medial geniculate body, and auditory cortex. These are the regions, circuits or brain areas involved in the analysis of the auditory sound or voice, and these are involved in any interruption or uh, problem in these circuits may be the cause of the uh, auditory processing disease. Clinical features: speech and noise difficulty, sound localization problem, confuses similar sounds, slow verbal response, poor or oral instruction following, reading, spelling difficulty. Diagnosis: speech and noise, dichotic listening test, temporal processing, sound localization, and lateralization test, language attention. Uh, differentiate from ADHD, attentions, language disorder, dyslexia, or learning disability, autism may be involved, peripheral hearing loss, and auditory neuropathy. Treatment: environmental modification, preferential sitting, reduce class sound, written instructions, auditory training, speech and noise practice, onimi, discrimination, temporal processing exercises. Compensatory strategies: ask for repetition, confirm instructions, and information. Language and education support, that is the most important in children with this disease. Reading and phonological support, teacher and family counseling, school accommodations. That is the goal. Prognosis: good prognosis, early identification, stable hearing, strong school support, and from the family. Consistent auditory language therapy. Challenges: background noise, untreated language, attention disorder, poor accommodation. Long-term outlook: patient may improve listening, studies, and academics performance, but some need ongoing accommodation. Recognition, target support, better listening and function should be there so that the student or the patient perform well. That is summary. Normal hearing input, cochlea is very important in this. Central auditory dysfunctioning, timing discrimination by neural integration, network involvement, brainstem, thalamus, auditory cortex, corpus callosum, and PFC. Clinical pictures: speech and noise difficulty, repetition, slow response, learning problem. Management, as already we go through it: auditory training, environmental support, speech language, and educational support. That is the graphical summary. What we need to know about APD. First, what is APD? Neuronal linkage. What is the neuronal linkage? Core mechanism of APD, common sign and symptoms, evaluation, management, and prognosis. These are the steps for APD mechanism and what we can do for these patients and children with APD. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases.